You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How can I help you today?
Hi, thanks for seeing me. I've recently noticed my skin getting really dry and itchy, especially on my arms and legs. But now, it's even started to crack a little in some places.
I see. Can you tell me a bit more about how long this has been going on?
It's only been about the past 2 weeks, maybe 3. It wasn't really a problem before I moved here to London.
That's interesting. Have you noticed anything that seems to make it worse, like certain soaps or lotions, or maybe even the weather?
Now that you mention it, the weather here is definitely different from back home. Besides cooler, it's much drier here, and it seems to rain a lot more. I haven't changed any soaps or lotions though. I brought all my usual things with me.
Okay, that's helpful information. Do you have any allergies or any other skin conditions that you know of?
Yes, I do have a respiratory allergy, perhaps never really had any problems with my skin before.
All right, and how about your overall health? Have you been feeling generally well otherwise?
Yes, I'd say so. I haven't been sick or anything. Although I do feel a little more tired than usual lately, but I thought that might just be from adjusting to a new place and a new school schedule.
It's good to know you're feeling well overall. Does anyone in your family have any history of eczema or other skin conditions?
Now that you mention it, my grandma used to have xeroderma, especially on her hands. She used this special cream, but I can't remember what it was called.
That's good to know too. Based on what you've described, it sounds like your skin is probably just dry and irritated from the change in climate.
Are you sure about it?
London weather can definitely be harsh on the skin, especially for someone coming from a warmer place.
Oh, that's a relief. I was worried it might be something more serious.
Not to worry. There are definitely things we can do to help manage your dry skin and improve the condition. I can recommend some gentle moisturizers and creams that will help soothe the irritation and keep your skin hydrated.
That would be great. Thank you. Is there anything else I should be doing besides using moisturizer?
Sure, there are a few things. Try to take shorter, cooler showers instead of hot baths. Hot water can actually strip off the skin's natural oils. Also, make sure you're drinking plenty of water throughout the day to stay hydrated from the inside out.
Okay, I can definitely do those things. Is there anything specific I should look for in a moisturizer?
Absolutely. Look for something fragrance-free and hypoallergenic, especially since you don't know yet if there's anything specifically irritating your skin.
Perfect. I'll make sure to keep that in mind.
Mihiraa, lotions and creams are of different purposes. The latter is more effective for very dry or cracked skin.
Thank you so much for your help, Mr. Jones. I feel a lot better knowing what's going on and what I can do to fix it. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi, Mihiraa. Come in and have a seat. Can you tell me a little bit about what brings you in today?
There's this bump on my forehead. It's been there for a few months and it's just getting bigger and bigger. I hate it.
I understand. Can you describe about it a little more? Is it painful or tender?
Not really, it just feels weird sometimes. But it's awful to look at. It makes me so self-conscious. I don't even want to go out anymore. It's horrible, Dr. Patel. Everyone stares, and I can't even wear makeup because it just makes it look worse.
Let's take a look. It does appear to be a cyst. Have you noticed any changes in it over the past few months?
Just that it's getting bigger. Is there something you can give me to make it go away?
We have a few options. This can sometimes be cleared up with warm compresses or medication, but in your case, it might be best to remove it surgically. It's a simple procedure and wouldn't leave much of a scar.
But what if it leaves a mark? I can't have anything else on my face.
I understand this is stressful, Mihiraa. These are usually benign, and the surgery is very routine. Scars are minimal, and we can discuss options to minimize them further. However, leaving it could cause discomfort or even infection.
I don't know. Can't we try something else first?
We can explore other options, but there's a good chance surgery will be the most effective solution. Would you like me to explain the procedure further, or perhaps some resources about epidermoid cysts? Knowledge can sometimes help ease anxiety.
Maybe. It's just, I've been feeling so down lately because of this.
It's completely understandable to feel self-conscious. Honestly, Mihiraa, talking about these feelings can be helpful. Would you be open to discussing this with a counselor? They can help you manage the emotional impact of this situation.
Doctor, I don't know.
It's completely normal to seek help when you're feeling overwhelmed. We can discuss some options together, and of course, the decision is entirely up to you. Right now, let's focus on getting you the best treatment for this condition.
Okay, surgery sounds scary, but maybe it is the best option. If it means this thing will finally be gone.
That's a very positive step, Mihiraa. The surgery itself is quite quick, and most patients recover well within a week or two. We'll schedule some preoperative tests just to be safe, and of course, the nurses will walk you through everything before and after the procedure.
What? More appointments?
Just some routine checks to make sure you're healthy for surgery. It's nothing to worry about, but it helps ensure everything goes smoothly.
You mentioned a therapist too. I never thought about it, but maybe I could use someone to talk to. I just feel so ugly because of this bump.
That's completely understandable, Mihiraa. Many people feel self-conscious about changes in their appearance. A therapist can help you develop coping mechanisms to restore your confidence. It's not about changing how you look, but rather how you feel about yourself despite it.
Yes, please. Maybe talking to someone will help me feel better about myself, even with this bump, or even after surgery.
That's a great decision, Mihiraa. Together, we can get you feeling better physically and emotionally.